Hi, I'm Dr. David Sparks, and our last episode we talked about obstructive sleep apnea and all of its devastating effects. Now I want to talk about the treatment of obstructive sleep apnea. If you've either gone to a sleep lab where you spend the night under observation or you've taken an at-home sleep test, you will have come to the realization that you do or do not have obstructive sleep apnea. A physician who is board certified in sleep medicine will give you all kinds of measurements that describe your brain waves, sleep patterns, how many times during the night that you stop breathing, all kinds of information about your cardiac responses to these episodes, blood oxygenation levels, level of snoring, and then a recommendation concerning next steps. It turns out that the gold standard for years and years, if you have significant obstructive sleep apnea, is the CPAP, which stands for Continuous Positive Airway Pressure. The National Sleep Foundation says the CPAP works by blowing air into the throat via a mask, subtly increasing air pressure in the throat and preventing the airway from narrowing and closing down. In other words, the CPAP machine creates enough pressure in your airway to hold the tissue open so your airway doesn't collapse. There are a few things to look for to ensure your CPAP machine is effective. First, it's important that the seal over your airway is tight enough to allow for continuous air pressure from your CPAP. There are several variations of the CPAP mask, including nasal or full face, and they come in many shapes and sizes, so it's best to try a few and see which style fits your face most comfortably. Also, look for machines that include a humidifier, as the airflow from the CPAP can dry out your mouth and nose. Some machines now include built-in heaters that warm the moist air first. Sleep doctors will adamantly tell you that if you have obstructive sleep apnea, the CPAP will help you overcome this disease. And I totally agree. One little caveat, if you wear it. The major obstacle, however, is something called compliance. And that means that the majority of people who are prescribed CPAP therapy can't tolerate them. CPAP is often referred to as a Darth Vader mask. CPAPs need to be cleaned all the time, aren't particularly attractive, and people who aren't compliant say they just can't sleep when they wear their CPAP. Sorry. The National Sleep Foundation and sleepfoundation.org reports a relatively new advancement approved by the FDA, and it's called hypoglossal nerve stimulation, or HNS. It's an entirely different approach to treating OSA. With HNS, a small device is surgically implanted in the chest, kind of like a pacemaker, and can be turned on and off by the patient. While you sleep, the device monitors your breathing and stimulates a nerve that keeps the upper airway open. The term hypoglossal nerve means the nerve that innervates the tongue. Remember, you don't stop breathing while you're awake, right? Well, that's because the tongue is awake and doesn't fall back into the throat and block the airway. That's what happens with obstructive sleep apnea. The tongue falls back into the throat. Essentially, this little implant keeps the tongue awake while you sleep and prevents it from lolling back into your airway. Initial research has shown that HGS improved patients' sleep apnea symptoms and had few side effects and very good compliance. Another technique, oral appliances can be fitted by a dentist who has been trained in sleep medicine. The appliance is custom fit to your mouth, and the theory is that it advances the tongue by moving the lower jaw forward, thus opening up the airway. I've mentioned this earlier, but oral appliances are far more effective for simple snoring than they are for obstructive sleep apnea. And again, they can cause problems with the temporomandibular joint. This is important. I have recently talked with an extremely impressive surgeon and was bowled over by what he told me about maxillomandibular advancement surgery. If performed by the right doctor, I think maxillomandibular advancement surgery, known as MMA, look it up on the internet, can be the most effective treatment for obstructive sleep apnea. In MMA, the bones of the upper and lower jaw are surgically repositioned to relieve airway obstruction. The maxillofacial surgeon that I talked with, and who has been doing this surgery for over 20 years as a means of, in his words, curing obstructive sleep apnea, tells me that patients come to his surgical center, have the procedure performed, stay overnight under observation, leave the next day, and in a few weeks are pretty much back to normal with cured obstructive sleep apnea, meaning no more sleep apnea. There are other surgeons who perform the MMA, but my experience tells me the doctor I know is amongst the best in the world. If you want me to refer you to him, contact me via the email that you see up on the screen right now. I'll give you a second to look at it. He has a free webinar that I can hook you up with and will explain the entire procedure to you. So good luck with that one.